call upon Mr. Adolphe to introduce Dr. Gaston for this evening webinar. Welcome to everyone. Thank you very much. Over to you, Adolphe.
Thank you very much, dear all participants. Today, it is a great privilege for me to welcome you all as we welcome our guest speaker today. Ladies and gentlemen, it is our privilege again and the honor to introduce Dr. Gaston Nyirigira, medical doctor with a master's in medical education with a fellowship in ECSA, a member of the Global Operating Room Advisory Board, and the distinguished senior consultant anesthesiologist and pain specialist at King Faisal Hospital in Rwanda. Dr. Nyirigira serves as the head of anesthesia and critical care services and holds the position of senior lecturer at the University of Rwanda, former National University of Rwanda. Dr. Nyirigira's professional journey has been characterized by a profound commitment to addressing acute and chronic pain management, particularly in low and middle-income countries, LMICs. His dedication to improving the quality of life for patients facing pain has driven him to pursue additional training in pain management beyond his background in anesthesiology. In the realm of acute pain management, Dr. Nyirigira has identified and tackled various barriers that hinder effective treatment, especially in resource-constrained settings. His insights into the challenges faced by patients and healthcare systems in LMICs have been instrumental in shaping his approach to this critical issue. Dr. Nyirigira's dedication extends to the field of chronic pain management, where he is a strong advocate for non-pharmacological approaches. He recognizes the limitations of medication-based treatments, often driven by affordability concerns in limited resource settings. His focus on lifestyle changes as an integral part of chronic pain management demonstrates a holistic and patient-centered approach here. One of Dr. Nyirigira's core beliefs is that the prevailing mindset surrounding chronic pain management can and should evolve. He envisions a future where pain management is not solely reliant on medication and where patients have access to affordable, effective, and comprehensive care. Ladies and gentlemen, we are highly privileged to have Dr. Gaston Nyirigira as a speaker of today for this TORG, the Operating Room Global webinar, where he will share his valuable insights and experiences on addressing burnout in the peri-operative settings. I give you a warm welcome as you join me to welcome Dr. Gaston Nyirigira. You are welcome, sir.
Tonight, I'm humbled to talk about addressing burnout and promoting the well-being in the perioperative setting. So I don't know why I feel passionate on talking about this topic, but if you're aware, anesthesiologists have tendency to develop burnout more than other healthcare providers. And you know about the suicidal rate is high. And maybe I believe that by teaching and talking about this, and you know, maybe I'm lowering my risk as an anesthesiologist. So for introduction, we should understand what is burnout. It's defined as a high degree of emotional exhaustion and depersonalization, an example of cynicism and the low sense of personal accomplishment at work, And when you define the cynicism in the feeling of distrust, that something isn't going to work out well, and you feel like you're doing nothing, you're no longer interested in what you're doing. And when you talk about the personalization, it occurs when you always or often feel that you are seeing yourself from outside your body, or you sense that things around you are not real. And then you develop low sense of personal accomplishment at work. I will quickly talk about the epidemiology on this matter. You can see, I will just touch different areas of the world, like where you see in Lebanon, the prevalence of burnout among Lebanese physicians. So was moderate to and high level of burnouts was detected, and was among 90% of surveyed physicians. And while 19% high, they have high level burnout. And you can see all the all the aspects of burnout were touched, and where you can see the high rate of burnout. And then when we come to close to our country, like in Rwanda, like Uganda, in 2020, also you can see the prevalence of burnout among nurses was detected, where other was also reported to be high. And then you go to China. So in this survey, the prevalence of severe burnout was at 8%. And the rate of intensity is here in the 3 dimensions of burnout is shown in the figure here. As you can see, the mean score of the 3 dimensions of burnout were 24 plus or minus 10 in emotional exhaustion. And you can see that all of these combine and suggest that emotional exhaustion and the penalization levels were both moderate, but that for this, the personal accomplishment level was high on this year. So when you go to Australia, remember all this is just around 2020. And you can imagine why this is being high, where 84% of healthcare workers facing burnout, which was putting the mental health at risk. And this is also due to, remember, the pandemic, the COVID-19, which increased the rate of the prevalence of burnout. So there's a study in Rwanda done by Eugene and the team, which was looking at burnout syndrome among anesthesia providers working in public hospitals in Rwanda. It was a cross-section survey. And with this, burnout was present to 26 of 99, which represent 26% participants. And it's not nothing. So this was one example in Rwanda, but you can see all of those. When you look at all over the world, you can see when this is from the overview of the number of PubMed hits for the research term burnout between 1970, when the term was introduced, and 2019. And this was before the pandemic. After the pandemic, you can see a lot of studies done on this. So this showing how burnout has affected numerous number of people, especially in the healthcare system. So talking about this, and we'll be also talking about the contributing factors to burnout. I know most of you are healthcare providers, and you know about the workload and job demand. efficiency and resources, meaningfulness of in the work, cultures and values. And you remember about, about the cultures, people express burnout in different way, depending on values in the culture and how they are trained on that. But still, it has an impact that we see. Control and the flexibility, social support, and the community at work. And when you go to this work-life integration, there's a lot of questions around that. So why do we talk about this? How do you relate this with what we want? So with the importance of addressing burnout in healthcare, one thing is understanding the root cause of burnout is step one in solving this growing crisis. And you can see on this table, on this slide, 6 root causes of burnout, which provides a clear path for specific interventions and strategies to effectively address the problem. So, and with this, the workload, fairness, community purpose, recognition and control. So there was emphasized this bias towards fixing people rather than fixing organizational issues and the job situation. Most of strategies start from individual aspects. How do you behave? How do your lifestyle? How do you assess have access to your healthy habit? Your daily activity, your day planning goes with whatever happens to you. So it's better to put emphasis on personal behavior than organization issues or job situation. So there's always associated impact of burnout, where you can see the classifying to individual and organizational, and then society. So when you go to individual, you find work-life integration issues, diminished career satisfaction, depression and mood disorders, substance abuse, suicide ideas. And we go to organization where we see the decreased work productivity, physicians handover. I know some of you work in the hospital and you can see how the staff turnover, and you see early resignations and decreased patient satisfaction. And when you go to society and patient safety issues, cost of care, diminishing patient access to care, impaired continuity of care, and all of those, we have impact. That is burnout. Sometimes it happens without notifying it's burnout. That's the time to go through ourselves and then go back and think about what is happening in our lives and then see what to do. So, this figure shows in categories of impact, mostly personal, professional, and social, as we said. So let's talk about strategies to address burnout. So we've got these 8 tips to help with the burnout, where we get, number 1, you get sufficient rest and sleep. And I know when we talk about this, everyone is concerned. We can ask ourselves questions: how much do we exercise? And how good is our sleep? And how good is our rest? So this is one of the things to think about. And take time off from electronics. These days we are addicted to electronics. And if you look at the time you spend on your phone, on computers, on TVs, this is one of the bad habits, and we should fix before we talk about other things. So do what you enjoy. This depends on what you like and what is your hobby. And then number 5, you reach out to those closest to you, family members, your friends. And then number 6, you get organized, clean, do some chores, eat healthy, and take a break. So this is a combination of things, but you can find a lot of things with just, you promote work-life balance, and I'll be just talking about healthy habits soon. And this, on top of this, you encourage, like, between colleagues, support, and mentorship. So there's two extremes. If one is really is well fixed, then you have vigor and dedication and the work, and then you have a good productivity from your engagement. But if you don't maximize all this, then they got a burnout and get exhausted, and cynicism and inefficacy. So it's good to promote the well-being by doing stress management programs, team building activities, recognition, appreciations, initiatives, professional development opportunities, and then try to adapt the health habits. So, of course, we said sessions of exercise, hours without the phones and electronics, healthy meals, and breaks. So all of those we have said, hours of sleep, glass of water. So, we are healthcare providers, but if you ask a question, how many people get that habit of drinking a lot of water? It may just be a big question. And the minutes of meditation. Some people think meditation is something religious, but it's not religious. Just to relate your mind and body, and then make sure it's one entity. Otherwise, sometimes we separate those from the body. We separate the body to the spirit. We separate the body to the mind, and cause chaos in our lives. So for perioperative settings, and so everything we have said of strategies work, but maybe this is a small family, like people working in theater, people working around the theater. It's one family, and mostly we face challenging situations. So we are like around the blood. We always touch the blood mostly. We always in the blood, and this is not a securing environment. So it's good to develop a good teamwork and be professional, and develop all those things. So the event managers should develop the simple mindfulness strategies like deep breathing, time, practicing gratitude, which is reinforced as one of the strategy. And also to create a dedicated wellness lounge, offering a range of respite activities, including mechanical massage, chair, aromatherapy, as well as yoga for those who can afford those, and then other coming mind-body activities. It's also good to help nurses and whoever is in perioperative setting to realize their stress level. Because you can't manage something you don't know about the level of how you're stressed, this will just allow you to create opportunities for happiness, for exercise, for mindfulness, and then emphasize on courses for leaders and nurses to improve resilience skills. Otherwise, the combination of this will just help improving wellness of the staff. So there's a lot to be said around this strategies, and around the impact of burnout if it's not addressed. It can say in healthcare, it's a new concept. it was happening many years ago, but was not addressed. And now WHO has emphasized on that and created strategies to go through that and then prevent it. So I wanted to make this presentation short and then have some time for discussions and asking questions. This will allow us to know and to get opinions from different areas of the world, because I know here different countries are represented, and would like to hear from you, and if any testimony, if any challenging situation, or if any question to ask or share, and then we can have a common understanding on how to develop strategies to prevent the burnout and improve the well-being attitude. So what is the take-home message? Early recognition of burnout is important. Understanding the impact of burnout is recommended in terms of personal, professional, and social. And prioritizing staff well-being is essential for any healthcare institution. And self-care by adapting health habits is important too. I would like to leave this time now for questions and discussions, and then we can have something coming together. Thank you very much.
Thank you so much, sir. This is a very important topic for everybody to at least to adhere to. And as we all know that most of us, we work in the health settings, but we know there are some bad things, there are some good things. Hello?
Yes, it is.
Hello? Yeah. So I'm sure that we have picked one or two things. And we all know, because I was just smiling when I saw we should be drinking water. So I'm just wondering how someone like me that will score for like 6 hours, how will I be able to adapt to that, taking of that water according to the presentation? I have one question here. Meaningfulness at work, is there an objective way to measure meaningfulness?
You mean effective way to measure what? To measure willingness?
Meaningfulness. You know, you mentioned meaningfulness from your slide. I think that was the third or fourth slide.
Mm-hmm.
Yeah, how can we measure this? Is there any objective of measuring the meaningfulness?
I don't understand that word because there's echo. I don't understand. To measure what?
Hey, Gaston. I think
Yes.
that's we can really make mindfulness at
mindfulness.
in our daily.
Okay.
Yeah.
Okay. So sorry. Talking about mindfulness is just we talk about mindfulness exercises. Mindfulness exercises is just the techniques used to harmonize your mind, your body, and your spirit. Because when they are separate, everything is distorted. So, for example, let's have an example. When you're doing yoga or when you're doing meditation, that's one of the exercise, mindfulness exercise you do, and then you harmonize those three parts of the body. I mean, of you, because it has to coordinate, and then so that one doesn't direct itself, and then you bring them back. Because, for example, if we focus on one thing that is negative, then everything we go just negative way. So this all those exercises just bring you back to the to the attitude where you focus on one thing at a time and then develop your well-being. So there are different exercises like deep breathing exercises. There's also a lot that there's some courses that teach how to maximize your mindfulness exercise. At the beginning, it's weird. Like you think, what is this? But once you keep exercising, you find the impact on how you feel or how you react, how you think, and how you behave yourself. So that's it. A measure to measure the mindfulness. I think that is personal, depending on when you started doing exercises, and then you see what the impact on your well-being. I don't know if you got the point, but that's it.
Okay, there's another question. In terms of sustainability, how can a health service manager in an operating setting practically do to assess and effectively manage burnout among healthcare providers in a shortage of staff setting?
Yeah, that's always a big issue. So one of the factors to develop burnout is short staffing and organizing a conducive environment. It's not easy when you are short staffed, and managers also get that issue to how to create a good environment, a pleasant environment in clinical allocation without having a good number of staff. And remember, that is the big issue we face in LMIC, where you are doing a task of 5 people or a task of 10 people. So that is challenging. But it depends on how the institution or department or a service, a unit is organized. I think for this one, the advocacy is recommended. And sometimes we try to cover without telling the administration how to fix this, or even strategies to fix this. So it's a challenging issue, it's a challenging thing.
Okay. I have some 2 people raising their hands. Maybe I will just call on Nelly. Nelly, you have the floor.
Yes. Hello, everyone. Thank you for this. I don't know if I'm audible.
Yeah, you are.
Yes. Thank you, Mr.
Yes,
Chairman. Mr. Wilson, Mr. Chairman, thank you so much for the invitation. My name is Nelly. Like you see, I'm from Botswana, Ministry of Health and Wellness under the mental health, as a mental health program coordinator there. So this topic really appeals a lot to me. I saw when you talked about the high prevalence, I did agree with you with the high prevalence that we've been seeing. The good thing about your presentation is it had representation and from different parts of the world, which is an empirical evidence to show that burnout is quite a concern. It's a public health concern. You spoke about issues of post-COVID, though you didn't speak much about it. I believe, post-COVID, of course, it had a lot of impact on high numbers or high prevalence of burnout cases, because COVID just came as a post-traumatic issue, and people's emotional and psychological well-being were left with a lot of vulnerability, I believe. So when we get to the slide, I don't know if you can go to it, of individual cases. You spoke about depression, you spoke about other physical illnesses that a person would present with. So I just wanted to say issues like issues of substance use and all that. I guess they also fall under self-destructive behaviors, because sometimes you don't realize that you are self-destructing. And maybe to bring to attention that there are certain self-destructive behaviors that we are not quite aware of, but they are there. And issues like reckless driving, nobody would believe reckless driving could emanate from stress. Issues like eating disorders, they do. Issues like being involved in criminology and substance use, as well as promiscuity. Those are some of the self-destructive behaviors that burnout can also bring, because you are actually trying to feel the pain with distracting yourself with a maladaptive way of coping, so I may say. I got very excited when you spoke about the meditation, that usually people like to attach meditation to religion, which is very true, because we have a lot of situations where people will be like, I won't do yoga because I'm a Christian. I won't do yoga because this. But like you said, mindfulness exercises are very critical to clinicians. And again, it brings intensive awareness of self. What you feel, what you sense at the moment, just to be present with the self at the moment, because it rejuvenates, it relaxes you. And I guess it also releases the stress hormone, as much as every physical exercise does. It reduces the stress hormones, and then you end up with calmness, and you don't have that stress. So I think my contribution would be like this. Admitting to burnout should be the first step in everything, especially when you have a lot of passion in your job. You think you owe it a lot, that you should not admit that you have a burnout. And that is where it really starts. And also to just distance yourself from stressors. You prioritize your health, as you said, and you just reevaluate your goals. Go back to the drawing table to say, what are my deliverables? Am I able to meet this at a certain time that I've put before me? Also, taking breaks would also help, as well as monitoring your stress levels. And maybe self-compassion, we take it light. Self-compassion just means self-care. So in burnout recovery, some philosophers like Duke and all that, they extend this issue that you should extend the same kindness that you do to your people, your patients, your colleagues, to yourself, so that you offer a sense of understanding. Then you'd be also caring in that manner. So that is it. But I would say add a little bit on recommendation to say we have to make workplace wellness a habit. And we have to ensure that there's health in all policies, because we cannot work without the mental health aspect, because that's the engine for everything. And what matters is sustainability. Like, if we are talking about all this thing, how sustainable it is. We need regular screenings in our workplace, not just do it because we have a situation, and then that comprehensive approach, I think you talked about it, where we'd involve the HR for considering the staff ratios, the wage, because you know what, we need money, that's how it is. And also talking about the welfare to be part of what is in those policies. With that, I would say thank you very much. I really appreciate and liked the presentation. Thank you.
Thank you very much. That's very good reflection. And so when we talk about the strategies, means, it's individualized to institution, to individual, and it's not like you just give the bigger lines and then everyone will adapt according to the culture, values, and the feasibility of any strategy.
Exactly.
Yeah.
Hi, Gaston. I think there are some questions from the chats.
Oh, yeah.
Yeah.
Okay. What is the question? Okay, so Okay, the measurement of mindfulness that was talked, and do the health in the region have staff resource to address the burnout situation? So there's a question from Stella saying, do the healthcare organizations in your regions, and regions, that means it's the world is represented here. Maybe I will talk about here, have staff resources to address the burnout situation. So first of all, in LMIC, it's a common issue about the staff resources, because as we said, one is shortage of staff, and this is one big factor to increase the workload, which is one big factor to burnout, develop burnout. So this probably was touched on. And in terms of sustainability, how can a health service manager in a perioperative in particular do assess and effectively manage burnout amongst healthcare providers in a shortage of, yeah, this is almost the same. Are there any effect of standing for a long time during surgery every day? How can it manage if yes? So when this question saying standing for a long time during surgery every day. So I was recently watching someone demonstrating some of the exercise the surgeon can do on a case. You know, standing, you're concentrated and you only focus your mind on the surgery you're doing, but your body is suffering too. So it was comparing how can we help our body, but also we keep the mind concentrated on what we are doing. It's the same. It's the same. You learn strategies how you can do stretch. You can stretch your muscles. You can change your positions and keep focusing on what you're doing. I think a simple pose. We don't have maybe a surgeon here. If you have a surgeon, maybe can give us experience. But surgeons can stretch their muscles and can do some exercise while they're doing surgery. Just a simple pause and continue, unless you're in a big emergency of bleeding, fixing, damage control, but this can be managed. So thank you. And does a breathing activity somehow help us to burn out in a health service burden? If so, how exactly does that work, and what specific task of activities are those? So I don't know what Israel is talking about, but team building activities somehow help ease the burnout. We said about the teamwork, and then support among the peer staff. So I think that is around there. How people can keep interacted and in a professional way, and then support one another. This helps in addressing the burnout issue. So low periop staff. Okay, this is the same. What are the major or basic signs of burnout syndrome? Oh, okay. So the major or basic signs of burnout syndrome, we talked about that, the personalization, cynicism, sense of lack of efficacy, like you feel exhausted physically, emotionally, and you no longer want to do that. And sometimes you get depression, sometimes it's associated with anxiety. And remember, all of us have started work being enthusiastic, being courageous, being eager to learn, being eager to learn new things. But after 1 year, 2 years, some months, a few years, you feel like you're no longer interested. You feel like you're no longer performing well. You feel like you start, escaping what you have to do. So this is one of the one symptom of burnout. Maybe you no longer want to work because of different factors, that we have said. So this sense of not keeping the momentum we had at the beginning is one of the biggest sign of burnout, and on top of others. How can one manage stress as a perioperative nurse when you are faced with some challenges every other day? Yeah. Mindfulness exercise, teamwork. Sometimes we don't address this to our managers. And one day we were talking about how taking like 10 minutes to go and get fresh air. Sometimes it's not possible in a very busy environment. And it's one day after day. So breaks improve this. Taking some time off improves this. Drinking water, deep breath. Sometimes we talk, you mentioned about this, the habits, like when someone tells you to deep breath, to do deep breath exercise, sometimes you don't feel there's no importance doing that. But it's really important as you keep practice, because when you go to some places, they say, okay, do deep breath, exercise of deep breath only. And then people get that habit. It helps a lot to develop that self-care attitude. Okay, so.
Thank you, sir. I think there is someone outside you have a question.
Yeah.
Morinda, thank you. I don't know if you have the floor.
Morinda, want to say something?
I'm not sure it's still online. Maybe we go to the next question. If there is a tool to assess the burnout, is there any way to stage it so that if it reached the end stage, someone can leave the job and find other place like business or something else? Is there any tools to assess the burnout, sir?
Tool to assess burnout?
Yes. Someone is asking.
There's no specific tool to assess burnout apart from just going through the symptoms. So I know everyone knows himself. Sometimes people don't know themselves, but among the team, you can have like discussion about the burnout symptoms, and everyone assesses him or herself in a unit, in the service and department, and then you realize it's just a self-assessment mostly to know what do I do like that I was not doing before. What is happening to me? Why am I reacting like this? Why am I overreacting like this? What is happening to me? And then you then find, and then you see, okay, this might be the symptoms of burnout. And then you can talk to someone. It's just self-assessment mostly, and then see what the level of your burnout. You can know what is happening based on the symptoms. Unless there's someone who knows how to measure the tool or anything to use.
There is actually no effective tool to assess burnout. But the other point is people around you can really diagnose that you developing or just have burnout with you, because they knew who you were before, and then this time they are seeing you changing completely, or you started changing, and they're gonna be telling people that, yeah, this may be burnout or not.
Okay. So this following question of Alphonse is the same about the staff. So, and thank you, Stella, for sharing some of the strategies. And Okay, if there is a tool to assess, okay, the same. Okay. So there's I didn't open yet, but
I think the founder has she has give us a clue on how to assess the burnout.
yeah,
So if you let us check our charts.
yeah.
Yeah. So she
People
dropped something
can go
there.
through that and see and then know how to measure burnout accurately and ethically. But I can see that it's based on symptoms. It's based on all of those symptoms we described. Yeah. It doesn't go far from what we are talking about. And things can change through the culture concept, because the way the cynicism is represented in Rwanda, maybe it's not the same as in North America or in Nigeria. So it's not like something standardized. It's a tool to help you. It's just to help to understand how you can measure, but it goes with the culture concept and the value, the culture values.
And I think we can also look at it through the health continuum. So, in the health continuum, we have the right and the left sides, the optimal and the other side as death. So I think we can also look at it through that health and illness continuum.
Yeah. So may I ask, can someone share any different like a testimony how you address issues of burnout in your institution? And if we had two, maybe from one LMIC and one from HIC, just to get the insight of what people do the other side of the globe.
Yes, I think I can say something on that. In Ireland currently, what the hospitals, what they do is that they have this health and wellness centers. So it's mandatory now, it's becoming mandatory anyway for each facility to have a health and wellness sessions. There could be a dedicated center in that facility whereby each staff or identified staff, maybe 2 or 3 members from a department, they take a break from everything else, go into that room. They bring in all these yoga instructors. If they want to do that, it's not compulsory anyway, but if people want to do it, they allow them to do that. And they have this health and wellness centers. That is how they have the well-being of the staff considered in Ireland at the moment. Personally, for me personally, I could remember a few years back that I was scrubbed into a case. I had to do bilateral osteotomies. It was almost 7 hours with lead jacket. I used the lead jacket. After that day, the second day, I came to work. I had to do 14-level spinal fusion. And after that, the third day, another 12-level fusion. So it was kind of this back-to-back. The fourth day after that, I just called in sick. I just told them, no, I can't continue anymore. That's if I continue like that. I had to call in sick because I just couldn't take it anymore. And I think personally for me, if I'm stressed out, I take more consolation in listening to music. I listen to music a lot around me, loud music, because I take more consolation in that. It's a way of addressing the burnout for me, and people could have other ways of addressing that. They could take a shower, they could walk around, they could do exercises. And I know someone mentioned standing for a long time a few minutes ago. Just to add to that, you could use compression socks at work. It helps a lot. It helps prevent this compilation of, it prevents swelling in your legs, extremities, and more. So there are different ways that people could address that. So I would say it's a collective effort, tackling burnout. It requires an ongoing commitment to well-being, not just personally to the staff as well. I know it's a common thing that there is shortage of staff. That is where the manager needs to set priorities. Managing is because if a staff member can't come in for whatever reason, then it affects every other staff member. You have to reshuffle the staff, you have to consider the skill mix, you have to check which patient is actually, which patient needs to be prioritized. So it's a collective approach if we want to address that. And I believe today's presentation has been very, very insightful. And I really want to use this opportunity to say thank you so much, Dr. Gaston, for sharing that knowledge with us. We're going to leverage on the knowledge that has been shared and make sure we prioritize our well-being. Sleep, like as you mentioned, I think that's talking to me as well. We need to prioritize our well-being. That is just it. I think Stella is mentioning something in the chat box. So Stella is saying the organization, she's based in the US, has a hotline for staff members. They can call, they can talk to a counselor, they can get set up with additional resources to address mental health. And yes, so that is another good approach as well. So there's a counselor assigned to everyone. Even in Ireland, they have this employee assistance program, that is EAP. So the EAP program is basically a counseling session for staff members. If a staff is feeling stressed or feels there's just no one to talk to at work, you could call the EAP program. It's a confidential service that runs 24/7. And it's a way of just getting someone to speak to if you want to let out what's on your mind or just address things that happened during the day. So counseling is another very good one as well. So thank you so much, everyone. I believe no other questions. I really want to say thank you to our speaker for honoring our invitation for today. Thank you to the TORG Education and Training Committee. And I want to say thank you to everyone connected from all over the world. And our next webinar is coming up. I mean, the global webinar is coming up in another 2 weeks. Let me just project my screen if everyone can see it. Sorry. So that is the next webinar that is coming up in another 2 weeks, the anatomy of the needle and ergonomics of stitching, getting it right all the time. So that is going to be taken by Prof. David J. O'Regan. Is the founder and CEO of BBAS. BBAS is Black Belt Academy of Surgical Skills, and BBAS is accredited by the Royal College of Surgeons of Edinburgh. Is a retired consultant, adult cardiac surgeon in Leeds. Currently he works in Malaysia. So he's going to be taking us in another 2 weeks, and there are upcoming chapter sessions as well that everyone could connect to. So I really want to say thank you so much. So the email of the speaker is in the chat box if anyone wants to reach out to him, or if you have more questions. If you don't mind, Dr. Gaston, kindly share the presentation with us so that we can project that when we share a replay of the webinar for today. So thank you so much, everyone, and have a nice day ahead. Good morning, good afternoon, good evening, and bye. I'll see you next time.
Thank you. Thank you.
Thank you. Thank you. Bye.
Bye.